Female breast anatomy, we are going to discuss. The breast undergoes three major cycles of development. The initial phase occurs between the birth and puberty, during which time the breast stroma and the glandular tissue increase gradually. Development of mammary glands is initiated during embryologic life but is only complete in the postpartum lactation of adult female. After the transient secretion stimulated by prolactin production in the neonate, mammary glands with their relatively simple architecture remain quiescent until the puberty. During this period, supporting stromal structures and the ducts enlarge in proportion to increase in the body size of individual, but no lobular development occurs in this stage. During the rapid growth that occurs at the onset of puberty is primarily from deposition of fat and development of periductal connective tissue, but elongation and thickening of the ductal system also occurs at this stage. Ductal growth occurs under the influence of circulating estrogens, growth hormone, and prolactin, but is independent of progesterone. The development initiated at the onset of puberty is generally complete by the age 20 years. If pregnancy occurs, the glands complete their differentiation and they reach functional maturity with interlobular branched ducts forming the buds that become secretory alveoli. This occurs under the influence of sustained increases in the levels of progesterone, estrogens, prolactin, and placental lactogen. The epithelial cells of the alveoli begin to accumulate the cytoplasmic organelles necessary to sustain lactation in the postpartum period. Following the parturition, the lactation proceeds as a response to environmental stimuli and the withdrawal of circulating progesterone. You can see in the upcoming slides what changes occurs in the period during the pregnancy and post pregnancy during the lactation. Prolactin originating in the anterior pituitary and some hormones, somatotropin originating in the placenta, stimulate the alveolar epithelium to produce and secrete the milk proteins, primarily casein and alpha-lactalbumin and the lipids. In response to suckling, crying, oxytocin produced by the hypothalamus but released by the posterior pituitary causes contraction of myoepithelial cells surrounding the alveoli, which expels the milk to assist the suckling child. With cessation of nursing, milk production also ceases because of a decrease in circulating prolactin and the inhibitory effects of non-expelled milk. The alveoli then return to their prior non-functioning state. By the age 40 years, the mammary glands begin to atrophy. Now you can see here, this is the diagram which usually depict the picture during the pregnancy. So what changes occurs in whole the breast nipples. So, but by the age 40 years, the mammary glands begin to atrophy. During and after menopause, the altered hormonal environment leads to involution, means decrease the glandular component, and then replacement with the connective tissue and the fat. You can see here there is a breast and nipple changes during the pregnancy. Initially, the breast volume is small, and as the pregnancy goes, you see in previous slides, the breast size increases, then all these ducts and alveoli retain the different connective tissues to adjust the hold the cycles of pregnancy for upcoming milk secretion. You can see here during third month size of the breast, and then around 6 months, and then 9 months, and at the time of lactation the nipple size increases, it engorges. So this is whole the anatomy from the birth until the puberty and the pregnancy, what changes occurs in the whole process in the development of the female breast. So guys, this is all about female breast. Thank you.